All right. Good morning, everybody, and thank you for joining the Solution Spotlight on Livongo Whole Person Solutions. I'm Cheryl George from Blue Cross North Carolina, and I am joined with me today by Perry Broeseker, who is the Regional Vice President of ASO Health Strategy from Teladoc. And he's going to present on some of the features and benefits of the solution. A couple of housekeeping items before we get started. This webinar is being recorded and it will be provided in a follow-up email to all of the registrants after the session, likely this afternoon, maybe tomorrow morning. After the webinar, there will also be a survey sent out. It'll be automatic through Zoom. Your feedback on that survey is very important to us. It helps us make sure that we continue to provide engaging and thoughtful content on topics that you actually want to hear about. Plus, by completing the webinar, you will be entered into a drawing to win a $25 gift card. So definitely keep a lookout for that. Last but not least, please feel free to ask questions throughout. We do have a few folks behind the scenes who will be answering questions in the chat box, and then we're also going to leave some time at the very end for some Q&A. So please feel free to add those questions into the chat box as they come available, and we will work to get to them. With that, I'm going to turn it over to our lovely presenter, Perry. I will let you take it away.
Thanks, Cheryl. Appreciate it. Hello, everyone. My name is Perry Broeseker, and I'm the Regional Vice President for ASO Strategy for Teladoc Health, who now owns Livongo. And today I just wanted to take some time to go through our chronic condition solutions that we launched through our partnership with Blue Cross Blue Shield of North Carolina this past year. So I know most of you are probably very familiar with our general medical solutions already because we've had those in place for quite a while. But our chronic care is really what the spotlight is on today through our Livongo Health solutions. So I'm going to go, the kind of agenda is I'm going to go through each one of the solutions, kind of give a high level overview of what the member experience looks like. Then I'm going to do a demo to show you actually the devices and how they work. To see a real-time experience of each one of the programs. And then I'm going to wrap up with ROI. So if you have any questions about, the clinical effectiveness in our programs and the ROI that we discuss with our self-insured clients. So please feel free at any time to interrupt me. If you want to wait till the end, that's fine. But if you have a question that you want to know right now or in the middle of a product or program, feel free to interrupt and ask that question. So through our partnership with Blue Cross Blue Shield of North Carolina, we have our whole person solutions available. All of our whole person solutions are available through that partnership. And these are the three similarities you're going to see with all of our solutions. So the first program we ever had on our chronic condition platform was our diabetes management program. And with the success of that program, we really tried to model a very similar member experience for each one of our additional programs as we added more to our platform. Because what we wanted is we wanted to kind of have a singular virtual door that a member can enter to deal with their multiple chronic conditions they're likely dealing with. Typically, we don't find someone that just has diabetes and is perfectly healthy in all other aspects of their life. There's a very high likelihood that they have other comorbidities they're dealing with, weight loss, hypertension, high cholesterol, et cetera. And that's, strategically why we added these additional programs because they're the comorbidities that people most often share when they have diabetes as a singular condition. So three similarities you're going to see are the connected devices. All of the devices that we provide our members with are not only connected, but they're cellularly connected, just like that SIM card in your cell phone. And what that means is now we don't have to worry about, the demographics we're marketing to not being super comfortable with technology or knowing what Bluetooth is or having a smartphone or internet, right? The entire connectivity is already built into the device and it's connected as soon as the member receives that device. So it just really helps in the streamlined effectiveness of our programs and making people more comfortable in using the technology that we provide them with. We then provide personalized health signals. And what that is direct feedback in the time that a member is using one of our devices to tell them what that data means. We understand for so many people, especially people that are newly diagnosed to one of these conditions, when they see a blood pressure come up on their device or a blood glucose level, they might not know what a 45 means or a 145/84, et cetera, right? There's a lot of numbers. And we don't want it to be on our members to have to decide what does this mean for them and what do they need to do about that. So we have AI, truly built into each one of our programs, and we learn more about the member and about their conditions the more they use the device. We can provide a more personalized approach. So for instance, we're not going to just say, hey, this is your blood pressure. We're going to tell them what that exact blood pressure means for them at that moment. And if anything needs to be done, maybe it's just feedback. Hey, you're on the right track. What you're doing as far as diet, exercise, et cetera, is working. Keep it up, right? Or maybe it's, hey, this blood glucose level isn't a good place to be right now. Let's help support you to get you back into a safe range, right? It's just that personalized feedback in the moment for our members. And last but not least, we understand that technology is really important. The most important part of supporting people with these conditions is that human touch. So we actually assign an individual coach to each and every one of our members that enrolls in our programs. So they can actually schedule one-on-one coaching sessions with that coach to talk about their diabetes, their hypertension, their weight. And that coach can then help them, overcome the specific barriers that each member has when it comes to these conditions. So I'll talk about a little bit more about that as we dive into our programs. So here's just a snapshot of the devices we actually do provide for our members. And you're going to see those on my camera in a little bit when I do the demo. But this is a picture of our BG monitor, our blood glucose device for each and every member that enrolls in our diabetes management program. We also have a partnership with Dexcom. So for members that have a Dexcom CGM, we're able to actually import that data and then use that data to better support that member alongside our meter that we provide that member. So it's really, really helpful to have all that additional information that comes from some of those CGMs out there. We're expanding those partnerships, year by year with different CGM companies to, at some point probably have a partnership with all of them to be able to import that data and support those members that are choosing to use CGMs to monitor their conditions. Right in the middle, we have our cellularly connected hypertension blood pressure cuff. Just a single button to turn on the device, reads your blood pressure in about a minute, and then it has a SIM card in it that automatically sends that data up to the cloud to put into real-time reporting and for coach to be able to see as well. And last but not least, we've got our cellular connected scale. I've got actually mine over here in the corner of my office, but the beautiful thing about this is you don't have to worry about what your weight was anymore, right? Lots of times we forget 5 minutes after we step on the scale what it said. But now all we do is we step on the scale, it automatically will show our weight, and then it automatically sends that weight up to the cloud via the cellular connectivity that this device has. So the member on their mobile app can see their weight each and every time they step on the scale. Maybe you want to step on the scale 10 times a day. Maybe you want to step on it once a week. Regardless, you're going to be able to record each and every time so you can look at those trends and patterns. And your coach can get that information as well to help you, keep accountable and keep on with your weight loss journey. So we're going to go now into our diabetes whole person program. Before I do that, I want to back up to you real quick. So to kind of explain what is whole person, what does it mean? Some of you might be familiar with our individual programs, right? Diabetes management, as a standalone. Maybe that's the only solution that's available, which is fine. The difference between our standalone programs and our whole person programs is how a member enrolls in the programs. So many times an employer will just put a standalone program in, then the next year they'll put another standalone program in, and then the next year they put another standalone program, right? Which is fine. But this really gives a more streamlined approach to help members start tackling these conditions on day one, regardless of how many conditions they're dealing with. So each one of these we consider an anchor program, and then we actually target the members based on their anchor condition. And then those members have the ability to enroll in other programs that they apply for as well. So for instance, if we target a member that has type 2 diabetes, right? There's an over 50% likelihood that they're also going to have high blood pressure and be obese as well. So that member can just enroll in diabetes and just focus on their diabetes. Or if they say, hey, you know what, I want to work on these other two aspects of my health because I know they're important as well, and there are two other conditions I have, they can enroll in hypertension and diabetes prevention at the same time. They're going to get all those devices sent to their house within 5 days. And then that singular coach that's assigned to them can help them with all conditions right off the bat. Just because we know there's so many similarities. For instance, if we can lose 5% body fat, we're going to naturally see some sort of reduction in A1C, a natural reduction in blood pressure, right? Because these conditions truly are very interconnected when it comes to the different aspects of these conditions as far as weight, blood pressure, high blood glucose, etc. So going into that, looking at diabetes, Our program covers both people with type 1 and type 2 diabetes. Primarily, the most of our members are type 2. But we know with this condition, it's very expensive, not only for the member, but for the employer as well. People with diabetes go to the hospital more than any other chronic condition group, most commonly for low blood sugar or hypoglycemia, for hyperglycemia as well. And the sad thing about this condition is there's still not a cure, right? There's no total cure to reverse or get rid of diabetes. So it's something that people need to manage on a daily basis for most of their lives, right? Now, we can get it in a much better place, which some people call remission, right? But we need to keep it there. It doesn't just go away forever. We need to keep with those habits to make sure that that condition stays in remission, or in what I would say a much more controlled state, where the member's not having to go to the hospital and increase their medications year after year. So now looking at the device again, as I said earlier, it's cellularly connected. So that means it comes connected as soon as the member receives it. They don't need to worry about Bluetooth or linking or syncing it. It's ready to use right out of the box. Usually comes about a half or a full charge, which can last up to a month at a time. Over in the left-hand corner right here, you see the cell signal. So we actually have a SIM card and we pay for the servicing. So, that's something that's included, so now the member doesn't have to worry about if they have a smartphone or a Bluetooth, or even how good their cell connection is on their phone, because this device has all of that inside of it. So now what that means is each and every time a member checks their blood glucose, this information automatically uploads to the cloud, gets put into real-time reporting, and their coach can review that information as well. To one, look at the trends and patterns, and to two, provide real-time outreach if deemed necessary 24 hours a day if a member falls out of range. One of our coaches is actually going to reach out to that member within an average of 2 minutes to provide real-time support, to many times avoid those unnecessary and very expensive emergency room visits that so many members are taking, truly just due to a lack of support. The other things that are included in this program are free and unlimited testing supplies. So not only is there zero cost to the member for the devices, we have unlimited test strips and lancets that are included with the device and can be ordered at any time by the member free of charge. So now you don't have to worry about where you're in your deductible as far as those strips are concerned. Sometimes the strips can cost $1, $2 a piece, depending on the coverage. And then they are applied to a deductible if that member has maybe a high, deductible health plan. So now our members don't have to worry about rationing the strips or only testing once a week, once a month because of the cost of the strips. They can test as much as they would like, use a new lancet each and every time they do that, because it's all inclusive in this program. That also helps our employers save money, because we understand that most employers are already spending an average of about $30 per participant per month on testing supplies alone. So now for each and every member that enrolls in these programs, that's all inclusive. So that money doesn't need to be spent in two different areas. The last thing I'll say about the device before I go into the demo, a little later, is that the entire member experience can be done from this device. You can reach out to your coach, you can upload your data, you can look at your data logbook, you can order more testing strips, and you can contact member support all from this device. We have a really nice mobile app that all that can be done too, which I'm going to show. But as I said, for those members that might be not as comfortable with technology, we want to make sure the member experience can be enjoyed from this singular device. Now jumping into our hypertension management whole person program. So hypertension is actually the leading cause for heart attacks and strokes in the United States. And I actually do have hypertension myself. And sometimes I think that the reason why it's such a dangerous condition is because of how silent in nature it is. Like for instance, with diabetes, if a member is out of range of their blood glucose, they are not going to feel well. Their body is going to tell them in a way they cannot ignore, something needs to be done to get my sugar in the right place, right? With hypertension, it's not so, right? Which is good and bad. It's good that it doesn't affect us on a daily basis and how we feel, but it's bad because it can result in some really scary situations. So for instance, I could have a really high blood pressure for the last 3 months. I'm probably not going to feel that much different than when I have a normal blood pressure. So in my head, I'm going to think nothing needs to be done. I don't need to go see the doctor. I don't need to do anything about this. But internally, it's causing a lot of damage. So with this program, one of our primary goals is to help with that awareness for the member to say, hey, this is your blood pressure. This is what it means for you. This is what you need to do about it, right? And being able to do so by taking a very small amount of a member's time on a weekly basis. So the device is very easy to use. We have a large cuff to fit the majority of most people's arm sizes. Very easy to use device. You're simply going to, it's going to come with batteries. You're going to put the cuff around your left arm. You're going to line it up with the arrow, and then you're going to hit this button, and it's going to power on, and it's going to read your blood pressure in about a minute. And then it's going to automatically send that number up to the cloud to put into real-time reporting that you can view and your coach can view as well. So it gives you that instant awareness of, hey, you know what? I am working on my diet. I am working on my exercise. My blood pressure is getting better. Or, you know what, I haven't been taking my medication. I have only been exercising once a week and my blood pressure is getting worse, right? But regardless, it's creating that awareness for the member, which is really powerful and helping drive that behavior change. So now moving on to our diabetes prevention program. We understand that, when we look at the national population, about 6% or so on average have diabetes. About 30 to 34% of people are considered pre-diabetic, which means that if something's not done to improve their health, they're going to end up with type 2 diabetes, which, as you know, is an irreversible condition once it's been had. So this program.
Hey, Perry.
Yes, go ahead.
Hey, we actually had a question on pre-diabetes during the registration, so I thought now might be a good time to bring it up. Somebody asked, what role does diet, especially whole foods, plant-based, and lifestyle have on diabetes prevention? Do you think you could address that either now or just as you go through your topic here?
Yeah, no, I'd be happy to address that now. So it's a great question. And the answer is it has a lot to do with it. Statistically, 100% of people that are pre-diabetic are obese or overweight. So obviously the primary goal here is on losing weight. Not diving too deep, but we understand that, a lot of it when it comes to diabetes and pre-diabetes comes to the foods we eat and the quality of foods we eat. And the sad thing is, a large majority of the high quality foods, organic, et cetera, they're expensive. It's not hard to understand why so many people, eat fast food so much of the time and eat highly processed foods, right? They're affordable, they're easy to be had, they're quick to eat. It makes sense. But the problem is, they cause a lot of damage, as far as we eat too many calories because things taste so good. Things are metabolized so much quicker than they should be because they're processed. There's a lot to it. So yes, eating healthier has a huge part in improving overall health and preventing pre-diabetes. And that's something that our coaches really did try to help our members with. We can actually do customized meal plans and customized exercise plans to help meet a member where they're at. We don't just prescribe a singular diet. We understand, just like everyone, it's all about moderation, but that's difficult, right? Some people say carbs are good. Some people say carbs are bad. So what we really try to do is just meet the member individually with our coaches to help them see where they're at, where their budgets, allow, where we need to focus that diet and help them, come up with that, on a one-on-one basis. Does that answer your question, Cheryl, or was there anything else in addition to that?
Nope, I think that was great. Thanks, Perry.
So looking at the member experience for our diabetes prevention program, as I said just a minute ago, there's a lot more people, a lot higher prevalence for this than diabetes. And it's really, really important because it is a condition that can be avoided if measures are taken in the right time. So our pre-diabetes program, our primary focus is on weight. Clinically, it's been shown truly the more weight that a member can lose, the better off they are in preventing diabetes. So that is really what the primary function of this program is on getting people healthier and losing weight, right? It's not just trying to lose weight in a super, super short period of time. It's about true sustainable weight loss, because you understand there's really no clinical value in losing 10 pounds in a month and then gaining 10 pounds back in the next month, right? It's about keeping that weight off. And we understand that huge lifestyle changes are not very effective in that. We've probably all tried those. What's the most effective way is small, sustainable changes. Maybe this week, I'm just starting my day off drinking 24 ounces of water before I drink my coffee and food, right? That's it. Very sustainable. The next week, maybe I'm, cutting back to 1 soda a day. The next week, as I said, it's just small, sustainable steps. We're not saying, hey, listen, don't ever eat a carb again. Don't ever eat, your favorite mac and cheese, pizza, whatever that is. We just want to help people keep things in moderation, which is difficult. It really is difficult to do even when you know that and when you have the information, but the sustainability is the most important part. So we've got our cellular connected scale, so the members can keep track of their weight. Their coach can keep track of their weight. You can see all those trends and patterns each and every time you step on that scale throughout your year. You want to show you the mobile app, you'll be able to see that. We also have, you also can import your activity through your Fitbit, Apple Watch, etc. So you can see all of that on the mobile app. And we also can do food logging as well. And we do food logging in a different way. So I'm sure many of you have probably used things like MyFitnessPal, other programs like that, which are great. And I don't say don't use them anymore. But what we find for so many members is it's a lot of work, right? Putting in every grain of rice, every carbohydrate, etc., that you eat, it's usually not sustainable, and people stop doing it. And so what we do in our food logging, and all we do is we ask our members to take a picture of their food. We've got a description under it. If they want to put, hey, I ate, 6 chicken nuggets and a cup of rice and a salad, fine, you can do that. But if all you want to do is take this second food eats first, take a picture of that and upload it, that's all you need to do. And what that allows to do is that allows your coach to be able to just keep a better accountability on your food, right? We don't really need to know how many carbs and how much you're eating if we're seeing, pizza, macaroni and cheese for breakfast, lunch, and dinner all week, right? So that's where the effectiveness comes in, is it's something that our members continue to do. And if, as I said, if they want to get deeper and really dive into their food logging more, they can do that, but we're not asking that automatically off the bat. So very easy to use program, very personalized program. And we see a lot of success when it comes to overall weight loss and keeping that weight off after year 1, which is really where the clinical impact comes. All right, so now I'm going to switch to my phone screen so you guys can see the actual devices in action and see what the mobile app looks like. So
Perry, quick question. Sorry to interrupt.
No worries.
Demo. We did have a question come in asking if a member already has a blood glucose monitor that they utilize, do they have to switch to your device in order to participate in the program?
So the simple answer is yes. We do have a pilot program where members can use their device and connect it. So that's, that is going to be a possibility. But yes, at this time, a member they can still use their other device, that's fine. But yes, they would need to use our device to be able to be connected, so for us to be able to upload all of that information. And just to share, we have this question all of the time, and truly the member experience that our members have shared, we really have not heard pretty much anyone say, hey, I wish I would have stayed with my other device. Because the member experience is really, really great for our device we provide our members with. We actually have designed and manufactured this BG meter and the strips ourselves. So we have full control of the connectivity, and we're actually able to change the member experience, improve it throughout the year by firmware updates, just like your iPhone or cell phone, right? So we don't need to say, hey, buy a new device every year. We can actually improve that device through just an update on your, on your current BG meter, a few times a year, many times. So that's the feedback that we have heard.
Thank you.
Yep. Any other questions before we go into the demo on any of the programs or the details? All right. Let's see if I can get this to work.
Hey, Perry, I'm sorry. We actually did have one other question pop in.
Okay.
For clarification purposes with the WPS program, is that only for pre-diabetic range or those that are already diagnosed with diabetes?
So for the DPP program, the member, by the CDC cannot be diagnosed yet with type 1 or type 2 diabetes. They usually have an increased A1C, BMI, one or both, that show pre-diabetes, but they can't have been officially diagnosed yet with diabetes in order to be enrolled in the program.
Okay, awesome. Thank you.
Yep. All right. Someone give me some feedback if you guys can see.
We can see your screen. Yep. Your desktop.
All right. Let's see my desktop. Probably see me. And now.
So Perry's getting a couple things loaded so we can walk through the demos with y'all. It looks like he's got
All
something
right.
pulled
Can
up
you guys see
here.
my screen now?
Yes, we can.
Can you hear me?
Yes, we can.
All right, great. So here's the mobile app, but first I'm going to show you the devices, the packaging, and the member experience. So these are the devices that our members receive. As I said earlier, all of them are totally free of charge. There's no cost to the member for the devices, supplies, any of that. Coaching is all inclusive for the member. The first program I'm going to show you guys what the devices are is our diabetes management program. Or you know what? Let's look at our hypertension management program. So this is the case that our cuff comes in. Comes with batteries, a quick start guide, a large cuff, and it's ready to use. So here's the cuff. So I am going to actually take my blood pressure so you guys can see exactly how the device works. Just to have a little fun, I do have high blood pressure myself. I've been doing a little better, but it hasn't been where I would like it to be lately. So if you guys want to put it in the chat, wherever you want, I want you guys to just put some guesses on what my blood pressure is going to be. Just so you guys all remember, 120/80 is considered ideal. I've had 2 shots of espresso, and I've already had breakfast as well. 2 cups of water. It's about 11:30. Going to eat in about an hour. So you guys can put some guesses on my blood pressure, and I'll go ahead and see what it is.
All right, we're getting lots of good guesses. We don't want Perry to talk because he's taking his blood pressure, but
All
it
right,
looks
there you
like
go,
in the
guys.
148 range.
144/76. Not great.
Who got closest?
Not great. So now you guys see that little ticking kind of box going around. That means it's sending that information up to the cloud. My coach is going to be able to see that. It's going to be put into a reporting, and I could actually go see that on my mobile app as soon as it's done. So that means it's done loading, and that's it. And that device automatically powers off. So it's going to be very, very easy to use. Very small amount of time to be able to get that information. So how'd you guys do on those guesses?
Lots of good ones. Most people guessed within 140 for the top number, 140/90, 142/86. Steve pointed out the espresso, so he thought you were going to be extra high, 150/89. But I think Jennifer might have been closest at 148/86.
Nice job, Jennifer. Hopefully I can bring that down some, because it's not great. My wife and I got 2 new puppies in January, and my exercise and what I've been eating have been in kind of survival mode, right? I eat as whatever I can, whatever's in front of me. I have not exercised much at all. So as I said, I know what it is, but we all deal with stuff in our lives that we get in certain periods, but hopefully in a couple months I'll be in a better place.
Yeah. So what you're speaking to is how lifestyle really impacts things like this.
Oh, it absolutely does. And when you guys see my logbook, I've been enrolled in these programs for 3+ years. You can see literally 3+ years of data and look at those trends. Like, hey, wow, in 2020, you really took a turn down, and then at the end you did, you know what I mean? So it's interesting to be able to see how the lifestyle, affects us and how we change, right? We're doing good now, but it's a journey, right? Not a sprint. And that's what all of this is about keeping that continuous journey. because it doesn't just go away when you do it good for a couple months. It's something that needs to be continued.
Absolutely.
So looking at our diabetes management program, this is the box that's included in. Livongo is a Silicon Valley based company. We were, so they really tried to get kind of an Apple experience when it comes to device and what we provide our members with. So everything in here is included. We've got the device right here, the quick start guide. Then if you take this back, got our lancing device, test strips, lancets. We have a charger here, but I have it under my case right now. And Livongo actually did stand for Live on the Go. A lot of members were like, well, when am I supposed to carry that box around with me? It's a great question. And so we actually have this really nice custom carrying case. It's made out of neoprene that comes with the device. So all that can be, kept portable in this little case right here. Right. So really nice setup. Everything can be carried wherever you're at, your lancing device, test strips, etc. So let's go ahead and power on the device. It's all touch screen. I've got two options to turn it on. I can usually either use this button on the side, or if I actually insert a test strip at the very top, it'll automatically power on as well. And so now what I'm going to do is I'm going to grab a test strip out. These are actually our own test strips that we manufacture ourselves. They only work with this device for any questions out there. I'm going to put it in, and then it's going to tell me when it's ready for me to check my blood sugar. The upper left-hand corner, that's my cell connection. So you can see I have a pretty good connection right now. All right, so I actually did check my blood glucose this morning, and you'll see that app, when I open up my app. But just to show you guys the support that we provide for our members if they were to fall out of range, many times too low of blood sugar, which can be very dangerous. I want to use this control solution, which basically tricks my meter into saying that my blood sugar is not in range. So you guys can see what that would look like in a real life situation. So if anyone asks, I have no idea what this actually is. Some of my coworkers say it's unicorn blood. I don't know, but it works. So a little drop on my finger like it's my own blood. Make sure it goes into the new strip. All right. It's gonna read my blood glucose. So that's a 40. And as you can see, there's a red dot next to it, which means that this is not, in line of where it should be. If it's in line, it'll be a blue dot next to it. And I can show that in the quick start guide. So for most people at a 40, this would be a very dangerous and very uncomfortable position to be in. Some people, they're almost blacked out at this point, nauseous, cold sweats, all kinds of different side effects that are very uncomfortable. So their body's going to tell them something needs to be done. So, but we do ask two questions each and every time someone uses our device, because it helps us personalize the experience the more that a member uses it, because we understand that each and every individual feels different at different blood glucose levels. So as we capture that information more and more, we can get to know the member and be able to provide more personalized support. So I'm going to say, just for our demo purposes, this is after breakfast. And I'm going to say, this is kind of asking me how I feel. I'm going to say that I feel stressed out, See, and then all I'm going to do is hit submit. Now that's automatically uploading to the cloud. My coach is going to be able to see that, and our support staff is going to be able to see that. And in the meantime, before I get support provided to me, is to tell me what I need to do right now. And this is always changing. This is not the same message. So it's saying, act now to bring up your low level. Here's how to handle this. Eat 15 grams of fast-acting carbs and recheck in 15 minutes. All right. So that's what I can do in the meantime. If I'm new to the condition, or, the truth is, clinically, when someone has, blood sugar that's not in range, your mind is actually not going to work as effectively as it should. It's going to be very cloudy. And it's going to be hard to think sharply and know exactly what to do in that moment, which is really scary. So while waiting for support, I'll show you what else you can do on here. You can contact your coach, share your health summary report, reorder more strips, contact member support. And I can also look at my logbook. So you can see I haven't been checking much, but you can see how often you've been in range, out of range, which is really nice to be able to see just directly from the device. So that's it. I'm going to go ahead and power off the device. That strip out. Put it back in its case. So any questions on that?
I don't think we have any questions at the moment. I can certainly see where Livongo gets its life on the go name with all of these portable devices.
Yeah.
Very applicable.
Absolutely. You know, as I said, the whole idea is when I'm showing this, I just really hope that everyone can see how easy the member experience is, right? It is very much designed for people, that I said, that are not comfortable with technology. It's not just designed for people that, oh, I love tech, I love gadgets. It's designed for people to use very seamlessly in their everyday lives. So I'm going to go ahead and jump into the mobile app. Hopefully everyone can still see my screen. So with our whole person solutions, as I said earlier, it's up to the member as to what programs they want to enroll in other than their anchor condition. So for instance, if they've got, as I said, diabetes as their anchor condition, and they also have, you know, deal with obesity and high blood pressure, if they say, hey, all I want to deal with is diabetes and blood pressure right now, that's fine. If they did so, all they would show is the 2 tiles that had to do with their program. So just diabetes, high blood pressure would show up. This weight would not, right? So as you can see, I said 1 program, 1 tile, 3 programs, 3 tiles, all in one singular place that they can look at all their information at. Their coach can look at all their information at as well. So for instance, my blood sugar, as you can see, this is already uploaded that reading that I just took, right? So it's already right there with those notes. If I want to put in some more notes, I can do that. If I want to keep that information for myself or my coach, but all those readings are right there. I can share this health summary report that has all of my diabetes and hypertension data with my coach from here as well. So I'm making a call, I'm getting a call. Hello, this is Perry.
I'm one of the expert coaches here with Teladoc. I'm calling because I was notified of your low blood sugar and wanted to make sure you're doing okay.
Yes, Amy, thanks for reaching out. Thankfully, I am doing okay today. I'm just actually doing a demo. But while you're on the phone, do you mind kind of walking through kind of what this experience would look like for a member that truly is out of range with their diabetes?
Yeah, absolutely. So the goal of our outreach is to make sure that the member's doing okay and understands what to do to treat that low blood sugar. So in this case, did you treat your low with a fast-acting carb like 4 ounces of juice, or maybe you treat it with something else like peanut butter, which is not actually a fast-acting carb. So we could offer a proper education to safely get that level back into the target range that we're looking for.
Okay.
Our coaching is individualized based on that real-time blood sugar result and what is tagged. So here I can look and see your blood sugar is reading 40. You tagged that you're stressed out and it's after breakfast. So this is where we can do some problem solving with you. Perhaps you did not eat enough carbs at that meal, or maybe you exercised more than your usual amount. We can look at these behaviors that might be causing the low blood sugar and provide tips to help prevent it in the future.
Thank you. And what other information are you able to see if I'm in other programs?
Yes, so we can also look for patterns in your logbook, so we can see any coaching sessions that you've completed and all your blood pressure readings. So I'm looking here in your profile, and I can see your last blood pressure check was complete on March 22nd, and it was 144/76. So we can identify any trends, find to see if the member has a knowledge gap. Our goal is to be always thoughtful, schedule coaching sessions for more in-depth support if needed. Our coaches can then review self-care behaviors and any strategies to help support our members in self-managing both their blood pressure and their blood sugar. So on one alert call, we can help to educate, motivate, and modify that behavior and drive.
Wonderful. Thank you so much for reaching out so quickly and for going through that. So I'll let you go, but thanks again.
Yeah, you're welcome. Hope you have a great day.
You too. Take care.
Bye.
Bye. All right, so sorry to interrupt that, but that truly was the coaching outreach. I mean, so 24 hours a day, 365 days a year, that is the exact member experience that a member would have if they fall out of range. So with their device, they can actually set the ranges customized if they would like. If they say, hey, listen, I'm super in control of my diabetes. I don't want anyone reaching out to me unless I'm a 30 or a 450. They can do that. But typically the devices come with a low of 50. So if it's 50 or below, a coach reaches out. If it's 350 and above, a coach reaches out. As I said, but that is up to the member. We also have what we call your circle. So for a lot of members, if you have family or friends that are involved in helping them manage the condition, they can add them to their circle. And what that means is now each and every time they test, A little message is sent out via text to those family or friends to say, hey, Perry tested at this time and this is his blood sugar. So they kind of have that peace of mind that, hey, I'm okay. They don't need to remind me to test. And that can be kind of a second layer of support for me. Right. So you can look at I'm just going to screen through this a little bit. I said this is 3 years worth of data, but you can see, I mean, there's a lot here. As I said, I'll say it many, many times, it's all about those trends and patterns that we're being able to see with our members. So the second program I'll go through is our blood pressure program. This is the one that applies to me the most because it's the one that I actually do deal with personally. You can kind of just see a quick snapshot on where my blood pressure has been lately. It's been going up slightly, right? You can see that. So it helps me kind of keep that awareness. And then I can look at I can go look at my blood pressure log, and this kind of helps me feel better to say, hey, I've done this before. I've gotten back into a better range. So if I go back, you can see here in September, I was doing a lot better, right? I mean, my numbers are in a lot better place. So I know kind of what it takes because I've done it to get back to where I need to be. And my coach can be there to help me do so. And the last one is diabetes prevention weight management program. You can put a goal weight if you want your most recent weight. This is all my information, PHI for all you guys. You can kind of see all your trends and patterns of the last 3 months, really nice visual to be able to see where you're at. I'm 6'3". It looks like I'm 206.5 pounds right now. Fine, right? But then I can look at all my weight data, right? So, I mean, I can see, how I've increased, decreased, trended just over each month to month. It's really, really, it's powerful. It's powerful to be able to see this as you look back in time. And then what else you can do on the mobile app? You can do food logging. As I said, you can take a picture of your food just with the camera on your phone, put information if you would like. And you can also sync your activity data. So Fitbit, Apple Watch, etc. All that information can be synced here. So you can look at this information. Your coach can look at this information as well. And then the other aspects, you can order more testing supplies, reach out to your coach, and contact member support. Then you can also see what devices you have synced to your mobile app, right? So a lot of great features on this app. And so the great thing is just all the information is one single place, one single mobile app, one single coach, one single phone number to call. It really helps, for a real seamless experience for the member versus for so many members where they have 5 different programs, 3 different phone numbers to call. They don't know which program does what, right? It's just really, it hurts the engagement. We understand that when you have one singular place for a member to go, it just helps that so much more with the engagement and utilization with each and every individual program. All right, so I am going to now go back to my PowerPoint. Right, can someone tell me that if you can see my screen?
We can see your screen. We did have a quick question that popped up in the Q&A box as you were going through it. Can a member's healthcare provider access their portal and reporting?
Can a member access their, what do you mean by?
Can their healthcare provider access their portal or reporting?
Great question. So they cannot, that's actually a great question for this slide. So they can't automatically, because of PHI HIPAA, it's something that the member has to provide, but they can send that health summary report directly to their provider, either on the spot, they can print it out and show it to them, take it to their walk-in clinic, wherever they may be, but it's on the member to provide that information. It's not something that we automatically provide.
Okay, awesome. And then a second question is there any EMR integration, electronic medical record integration?
We do. It just depends on the EMR, but that's something we can work on by a case-by-case basis. But there is lots of the major ones we do work with and are able to implement that data into.
Okay, awesome. Thank you.
No problem. So yeah, perfect question. This is just a snapshot of that health summary report. Is that you can print this out if you want to bring this to your doctor's office, or you can send it via email directly from your BG meter or mobile app. But all of your information from your blood pressure, blood glucose will show up side by side. So they have actually data to work with to help you with your condition. Because for so many people, they have little to no data. They don't really know why their A1C is where they're at. And so lots of times what their doctor does is just puts them on more medication because they don't have any more information except for A1C. But this specific information is so incredibly helpful for physicians to better help their patients. So now I'm going to close out with MyStrength Complete. That's our behavioral health, mental health solution that is available for all members. And the great thing about this program is it really meets the member where they're at and their needs, right? You know, the truth is all of us have mental health needs to some capacity. I actually do see a therapist once a week in person. You know, that's just where I'm at, you know, and it's very helpful for me. For some people, they're like, you know what, I'm not there yet, or I might never be there. Maybe just some digital solutions, some reading content, just some awareness is most helpful for those members. So what this program is it's trying to meet every member where they're at in their health, in their mental health journey. As I said, whether they don't even want to do anything with it, that's fine. It's there for them. Or depending on where they're at in their severity, you know, they can choose, as I said, some more kind of self-help structured digital courses. Or if they're like, you know what, I have a diagnosed health, you know, mental health condition, or I'm really struggling in this and I need to speak with someone, a physician, a therapist, we have that available as well, right? So it's that full spectrum of care needs through our mental health solution, up to the member and how they want to interact with us, how much they want to interact with us. A big difference between our mental health physicians, workers, versus other programs, you actually are going to select your provider. So if you need a psychiatrist to help with medication management, you're actually going to be able to see the picture of that physician, where they went to school, their specialties, all of that. And you're going to be able to look through all of them that are licensed in your state and select that provider. And you can actually continue care with that same provider to help with that experience. Same with if you just need a therapist, if you just need a licensed mental health therapist, psychologist, etc., you can select that provider and continue care with that same provider on a weekly basis, monthly basis, however often you would like to do so. And they actually have access to your medication management, so they can see if you're on any medications and help with that process as well. So very good, very great, complete program when it comes to mental health needs. It's all about that personalization, right? Finding a provider that you know meshes with the patient, you know, someone they like to work with. If for whatever reason they don't, they can choose another provider and continue care, you know, with another provider if they would like to. But over 90% of our members that do engage with a provider stay with that same provider for their entire journey, however long they need that for. Just a few, you know, data points for you guys before we kind of go dive into just a customized business case. As you can see here, data is really important to us, and that's really what's driving what we do for our members. We're using that data to better help our members because we understand that that is what drives clinical improvement, which is the only way we can see an ROI or any kind of financial savings is through truly impacting our members in a clinical way. This is one of my favorite statistics. We have a 90% retention rate at 12 months, which means that 90% of members that enroll in one of our programs are still enrolled and active after 12 months, right? That's so incredibly important when it comes to these lifelong conditions. And then when we talk about behavior change, our average reduced A1C is continued for an average of 5+ years, which means our members are truly taking into account these small but sustainable behavior changes, and they're keeping them year after year, which is where the clinical impact comes in, is that reduction over time.
Thanks, Perry. I do just want to pop in real quick and do a quick time check. We're about 10 minutes out, and we want to leave a couple minutes at the end for Q&A. So just want to pop in there.
Yep, I think we only have about 3 more slides.
Perfect.
So I won't keep this up long. You know, Teladoc Health is a company. We have over 12,000 clients, average of 90% client retention, which means that clients that decide, hey, I went through an RFP, I saw the demos, I saw the programs, I saw the ROI, you know, they're truly seeing these solutions successfully, you know, integrated in their populations. Members are actually using them. They are seeing a clinical impact, which is resulting in very significant cost savings when it comes to each one of these programs that we have on our solution set strategies. So with that, kind of taking into account some of these savings numbers, I put together just a basic business case. So you guys I can walk through kind of the straight line math of what our cost savings looks like. So I'm just going to take a minute to do that. So I've got one of these for diabetes, hypertension, and DPP. I don't have time to go through all of them. They're very similar in nature. So just looking at, you know, a lot of average clients out there. So for a client that has 8,000 covered lives, probably 4,000 employees, Typical prevalence is about 6%. We'd say they probably have about 480 people with diabetes. And we'll always get this information from the health plan to verify, to actually look at the true numbers for the employer. We estimate about 25% of those people will enroll in the program, and the client only pays for members that enroll. So if you have 20% enrollment, you only pay for the 20% of people that actually enroll. You're not paying for people just because they're diagnosed with the condition. So we estimate about 120 people out of those will actually enroll, which means the employer is only paying for 120 of those members. So the cost of the Diabetes Whole Person program, which is inclusive of all programs if a member chooses to use them all, is $95 per participant per month, times 120 enrolled times 12, which means for the first year to be about $136,000. Looking at our book of business, our average clients are already spending about $30 per participant per month on testing supplies alone. So we kind of take that away from this cost, because you don't need to be spending that in two different places. So the incremental costs are kind of like the cost that you would feel. It's about $93,000. The great thing about our partnership with Blue Cross is we've got claims-based billing. So they're not even going to necessarily feel this cost, because all of these conditions can be billed as a claim through the health plan. So we've had many case studies done on our conditions, truly looking at reduction in overall claims costs. And our whole person diabetes condition shows an average of $180 per participant per month on cost savings. So we estimate in just the first 12 months, we'd see about $259,000 in gross savings, $165 in net savings. And where we really try to focus is on this 3-year net savings, because we know that, hey, it's great news that you're going to save money and not, lose money in the first year, which most programs are, but we can only do so much clinically in the first 12 months. So this is really where we try to focus, is on the 3-year net savings. So as you can see, for that 8,000 life client, if they were to have these programs in place, net savings would be about $783,000 for all 3 programs over a 3-year span. So really significant cost savings. Not only, programs that truly change the overall lifestyles of our members, we're seeing great reductions in cost savings for the clients and for the members as well. Last thing, the value of our Blue Cross Blue Shield of North Carolina partnership. We have preferred pricing, lowest pricing for these programs out there. Very simple contracting. We don't need to do a big long redlining process. It's a simple, like 2-page CCS that the client agrees to, and it's just an addendum to their current Blue Cross contract. So very simple. Needs very little bandwidth as far as adding their programs. Eligibility, claims integration, data, all of that's already set up through our partnership. So we don't need to add additional charges or time to do all of that. It's already been set up. Regular member communication. So Teladoc Livongo, we do all the marketing and outreach using the claims data from Blue Cross Blue Shield. So we are in charge of making sure that members are engaging and using our program, and we provide those regularly monthly eligibility reports. So a lot of support, a lot of value through this partnership to make this a program that, if it fits, is very easy to implement and very easy to manage through our partnership. So with that, and we have a couple minutes left, that is all I have for you as far as information. I know it was a lot. I do want to pause for about 5 minutes or so for questions.
Yeah, thank you, Perry. We have a question from Nicole. Do you disenroll inactive members and discontinue charges? How often do you reconcile this?
Great question. So I need to confirm. I think it's a 6-month. Yeah, I think we have a 6-month lapsed user. And Steve, you can correct me if I'm wrong. But what that means is, with our lapsed user agreement, if a member is not active for 6 months, we take them off of the eligibility file and stop billing for them. But what that also means is that members are billed for a minimum of 6 months. And the reason for that is because we provide them the devices, all of that on day one, and they keep that. So that's just to basically recoup our costs from all the devices we provide their member when they enroll in the program.
Awesome. And then we have another question. If Hughes asked if you could discuss again the savings to the member.
Yes, savings to the member. The devices are free. And the really big savings is the supplies for diabetes management, especially those test strips, lancets, and stuff. That's something they no longer have to worry about covering themselves. That's all inclusive in an unlimited way for the member, which is a big cost savings.
Awesome.
I guess the third thing I would say, we never want to say, hey, replace your provider in any way. But our coaches many times fill the gaps and questions, and lots of times office visits when it comes to support that so many members just don't have, except for their endocrinologist or physician. So it's another thing where we see some members, is just they don't have to go to the doctor as much because they can get some of that support from their coach as well.
Mm-hmm. So it sort of cuts back on that. It's awesome.
Yeah.
All right. I'm going to monitor the Q&A in the chat box for just another moment. I don't think we're getting any new questions. Wanted to see if there's any that we wanted to touch base on again. And I don't think so. And if we wanted more information, who would be the best person? Where would we go to get more information if we had further questions about Livongo Whole Person Solution?
Yeah. So for any, clients out there, I'd reach out to your account executive. I'm very, I stay in close contact with all of the account executives at Blue Cross to be able to help support them, with all the details of these programs. But I would reach out to your account executive off the bat to say, hey, I'm interested in this program. I've got questions, or I want a customized business case to kind of see what this would cost and what kind of cost savings I could actually have based on my claims. We can do that for you in a very short period of time. So my first point, for consultants out there, hey, easy, you have the relationship, or if not, I've got my contact information up here as well. Feel free to reach out to me, and I'd be happy to work with you and your account executive at Blue Cross to be able to help support you with any of the needs of these programs or questions you may have.
Awesome. Thank you for that, Perry.
Yep.
All right. So I think we're wrapping it up. Thank you everybody again for joining us today. If you joined late or had to jump early, just a friendly reminder that this webinar is being recorded and will be provided in a follow-up email no later than tomorrow afternoon, but probably a little bit earlier than that. Also be sure to complete the post-webinar survey for a chance to win a $25 Amazon gift card. And we will be hosting these solution spotlights on a monthly basis throughout the rest of the year. Next month, we are very excited for our spotlight on pharmacy. And we're still working out some of the final details for that, but I will go ahead and put the link to register in the chat and in the follow-up email. So if you're interested, you can go ahead and register and add that placeholder to your calendar. With that, I want to give another thanks to Perry for joining us here today. And I hope everybody has a great rest of their day. And we look forward to seeing you next month. Thanks all.
Take care.